Hi there, Baby Doc here with some sage advice for expectant parents and newborn healthcare professionals about necrotizing enterocolitis, NEC. Necrotizing enterocolitis, NEC, is a serious illness primarily affecting premature infants involving the death of intestinal tissue, causing a severe infection. Risk factors for NEC include preterm birth, low birth weight, infants, formula feeding, difficult birth, or low oxygen levels at birth. NEC can also be associated with conditions like congenital heart disease, bloodstream infections, or hypotension, as well as babies with prior intestinal infections, maternal drug use, maternal hypertension, and chorioamnionitis. In rare cases, NEC can spread within a nursery. In addition, infants receiving blood transfusions may have an increased risk of NEC. Finally, H2 blockers, used for acid reflux, may increase the risk of NEC. Symptoms may include abdominal distension, feeding intolerance, green bile-colored vomit or gastric fluid, bloody bowel movements, signs of infection like lethargy, apnea, or a slow heart rate, as well temperature instability. Diagnosis is typically made based on the infant's symptoms and confirmed with an abdominal X-ray. NEC on X-ray has bubbly appearance in the intestine, pneumatosis, and or free air in the abdomen, pneumoperitoneum, as well as air in the large veins of the liver, portal air, as seen here. Treatment depends on the severity of the condition and may involve stopping feedings, gastric tube to suction, intravenous fluids and nutrition, antibiotics, frequent abdominal X-rays, blood tests, and vital signs monitoring, oxygen or mechanical ventilation, as well as isolation, and in severe cases, surgery may be needed. NEC can have serious consequences, including intestinal perforation, short bowel syndrome, intestinal strictures, growth restrictions and developmental delays, liver disease, as well as increased risk of rehospitalization. While the exact cause of NEC remains unclear, some preventive strategies have been identified, such as the exclusive use of human milk, standardized feeding guidelines, avoiding prolonged antibiotic use, cautious fluid intake, careful use of H2 blockers, and administering corticosteroids to mothers at risk of preterm delivery. Necrotizing enterocolitis is a serious condition, especially in premature infants. Early recognition and treatment are critical, and preventive measures like feeding with human milk can significantly reduce the incidence of NEC in these vulnerable infants. Be sure to subscribe to McGlinn Institute Neonatal's YouTube channel and join me, Baby Doc, for more sage advice.